Hello, we're back for our third installment of getting to know Eric, our new president and CEO of Bryan Medical Center. Why don't we just start with relationships and your kind of view of how you're going to lead the medical center and how relationships are core to all of that?
When I think of relationships, Bob, I actually think of an image that you'll remember well. It's an image that Kim Russell used when describing what a successful organization looks like. And it was kind of this vision of a wheel, and at the front part of that wheel was employees and relationships with their employees or employee engagement. By having strong employee engagement, it leads to strong physician engagement or physician relations. And strong employee engagement, strong physician relationships leads to an outstanding patient experience. And I don't think it's that much more complicated than that. So much of it is based on our ability to deliver on what we say we're going to do, on our ability to exert this influence or care for our communities. And I think it comes down to just those three components. But if we start with relationships with our employees, that will lead to our physicians wanting to practice here, send their patients here. That will lead to an outstanding patient experience.
You know, when we've been meeting over the last couple of months, gearing up for January 1, you know, one thing that I thought was really intriguing is the concept of neighbors, and you were referencing, you know, the Good Samaritan and so forth, of how we should think about the people we serve. I think our team would be interested in hearing your perspective on that and how that'll be a core of what you want Bryan Medical Center to be.
I've come to reflect on one of the things that makes, I think, Bryan really special is there's this level of pride or something ingrained in who we are that largely we're Nebraskans caring for Nebraskans. And that made me reflect on this notion of neighbor, and you know, whether the neighbor lives down the street from me on South 77th Street or lives in McCook or Chadron or Fairbury or Falls City, really they're all our neighbors. And this opportunity, if we see the patients we serve as taking care of our neighbors, it instills both a level of pride and a level of responsibility for the service that we get to be a part of.
I think that's a great kind of foundation for some of the challenges, to help us meet some of these challenges. What do you think are some of the strongest headwinds facing healthcare, and your thoughts how we collectively as a team need to navigate through it?
Yeah, well, you said it, as a team, that's how we're going to navigate through it. But I think two of the most significant challenges we're experiencing right now in our industry, one is first and foremost is workforce, as you know, and it's not only engaging and retaining the incredibly talented people that we have on our team today, but it's finding new workers, whether currently or building a pipeline of workforce over the course of the next handful of years. The second, I would say, is financial challenges. The financial headwinds are as tough as I've seen in my career, certainly, and it's a confluence of a lot of factors. It's a confluence of, or it's a mix of the payer environment and government pay just not meeting rising costs of what it's taking for us to take care of people. It's supply chain challenges that are kind of remnants of the pandemic, inflationary challenges. All of those things are eroding at really the small margins we were making to enable us to invest in facilities and technology and workforce.
So with all of that, on one hand, it's kind of like same as, you know, keep things going. What type of things do you think you might want to change up as you go into this focused role?
I don't know that I would say change much, and some of that is a re-engagement with the culture that has earned the reputation that we've afforded or enjoyed. So a lot of that is to a degree, maybe some may say back to the basics, but it's the level of relationships that we're going to be able to engage with our leaders, with our team, with our employees directly. I think if we focus on leader relationships and relationships with our employees, the rest takes care of itself.
In a couple weeks here, it's going to have a new dedicated Bryan Medical Center senior team. Tell us a little bit about what you've learned about your immediate senior team and what you expect out of them and what the organization, specifically the Lincoln-based team, will see from your team.
It's really a new opportunity to introduce this Bryan Medical Center senior team. You know, I think about the evolution of our health system. Bryan Health really has evolved from Bryan Medical Center, and as we've grown as a health system, this has afforded us the opportunity to put attention back on Bryan Medical Center as a significant part of the health system. I'm really excited to work with the BMC senior team. They're people that, one, are engaging, two, care deeply about others, and three, I think just get the way that we want to do things at Bryan. We want to do things with integrity. We want to do things, I would say, the Nebraska way, with hard work and genuineness and honesty, and I'm excited to work with them.
I think it speaks to the opportunity that people have working at Bryan, and can you maybe talk to the opportunities you see for our entire workforce at a place like Bryan Medical Center?
One of the most uplifting moments that I've experienced over the last few months, and that's been having lunch with our staff. So over the last few months, I've had on a handful of occasions lunch with 12 to 15 employees in a handful of different settings. Gosh, Bob, I was so uplifted to hear our team tell me the things they love, overwhelmingly. The fact that they feel cared for here at Bryan, that they feel respected by their colleagues, their teammates, that their leader cares about them and creates flexibility for them. They don't miss their kids' activities now. I think so much of our team is so committed to, one, their profession of caring for people, and two, to Bryan and the maintaining, stewarding the reputation that we've earned, that I'm excited to the chance to kind of continue to unlock that connection of meaning and purpose in our team.
I'm thrilled for this opportunity for you, Eric. All the best as you take on this endeavor, and we all look forward to seeing what the future is under your leadership as we approach our 100 years of serving this state.
It is an incredible privilege to steward a community asset like Bryan, and I'm excited for the time ahead.
Everyone, I hope you see some of the wisdom in the selection and stuff. I think we're in great hands with Eric leading the largest medical center in our system, and frankly, in my opinion, the best medical center in the state of Nebraska. And I think our awards and acknowledgments and quality is indicative of how great of a place this is. So thanks, and you're going to be seeing a lot more of this guy in the years to come.
Thanks, Bob.